Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Beck Depression Inventory assesses the severity of depressive symptoms in individuals. It measures cognitive, affective, and somatic aspects related to major depressive disorder. The instrument evaluates factors such as sadness, hopelessness, irritability, and physical symptoms, including fatigue and changes in sleep patterns. Its main purpose is to aid clinicians in diagnosing depression and monitoring treatment outcomes. The tool is widely utilized in clinical and research settings to quantify symptom intensity over time. The Beck Depression Inventory is primarily indicated for adult patients experiencing symptoms of depression in outpatient and inpatient clinical settings. It is widely utilized among individuals with mood disorders, including major depressive disorder and dysthymia. The instrument is particularly useful in psychiatric, primary care, and general medical environments to assess the severity of depressive symptoms. It aids clinicians in monitoring treatment progress and facilitates the detection of subclinical depression in medical populations. The tool demonstrates high reliability and validity across diverse demographic groups, making it suitable for repeated use in longitudinal studies and clinical practice. The Beck Depression Inventory consists of 21 items, assessing the presence and severity of depressive symptoms. Each item presents 4 statements reflecting increasing levels of symptom severity, such as sadness or loss of interest. The respondent selects the statement that best describes their experience during the past 2 weeks. Responses are scored from 0 to 3, with 0 indicating no symptoms and 3 representing severe symptoms. The total score is calculated by summing individual item scores, yielding a range from 0 to 63. Scores from 0 to 13 suggest minimal depression, 14 to 19 indicate mild depression, 20 to 28 correspond to moderate depression, and 29 to 63 reflect severe depression. Clinicians should administer the inventory in a quiet setting, ensuring the respondent understands each statement before answering. Interpretation must consider cultural and contextual factors that may affect responses. The Beck Depression Inventory demonstrates a sensitivity ranging from 80 to 90% in detecting major depressive disorder, indicating its ability to correctly identify individuals who truly have depression. Sensitivity refers to the proportion of true positive cases accurately recognized by the test. Specificity of the Beck Depression Inventory varies between 75 and 85%, reflecting the instrument's capacity to correctly identify individuals who do not have depression. Specificity represents the proportion of true negative cases correctly classified. For example, a sensitivity of 85% means that out of 100 patients with depression, 85 will be correctly identified by the Beck Depression Inventory, while 15 may go undetected. A specificity of 80% implies that out of 100 individuals without depression, 80 will be properly ruled out, whereas 20 may be falsely labeled as depressed. These metrics are influenced by the chosen cutoff score and the population being assessed. The Beck Depression Inventory was developed in the mid-20th century by Aaron T. Beck and colleagues as a self-report measure to assess the presence and severity of depressive symptoms. Initial validation studies demonstrated strong internal consistency, with Cronbach's alpha values typically exceeding 0.8, indicating reliable item intercorrelations. Concurrent validity was established through significant correlations with clinical diagnoses of depression and other standardized depression rating scales available at the time. Subsequent research involving diverse populations and clinical settings has reinforced the instrument's psychometric properties, with test-retest reliability coefficients generally ranging from 0.7 to 0.9 over intervals of 1 to 2 weeks. Factor analyses have identified consistent underlying dimensions corresponding to cognitive, affective, and somatic symptoms of depression. Cross-cultural adaptations have undergone rigorous validation processes, maintaining construct validity across different languages and cultural contexts. The Beck Depression Inventory has also demonstrated sensitivity to changes in symptomatology, showing utility in both clinical assessment and treatment outcome evaluation. These empirical findings have supported its widespread acceptance as a robust measure for depressive symptom severity in adults. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.